And a very good morning to you this morning. Broken toe got me a little bit late to the table to sit next to you and say good morning. But a good morning to you this Easter Monday. Now, South Africa has reported 145 new COVID-19 cases. The death toll stands at 25. Health Minister Zweli Mkhize is urging people to wear masks and follow precautionary measures. For more details, I'm joined by the Health Minister this morning. A very good morning to you. So we've seen an increase of 145. What does it say about the status of where we are now and what we're learning about this?
The numbers are going to always be up and down in the sense that we will not be able to get one set of figures. But because of late we are increasing the testing on the public sites, public center sites, we are actually thinking that the reason why we're picking up is that we might now be reaching people who are not necessarily sick, but who are referred through the screening and testing that we're doing on the field. When we looked at the numbers of the past few days, 5,000 tests that were done, 3,000 were coming from the public sector, which is a change from what has been happening in the past few weeks, where people were coming from the private sector largely. So it's a pattern that's going to help us to be able to determine the extent of the infection on some of the densely populated areas. And up to now, most of the people have not been really in the public hospital. So we want to be able to see how many people we could be getting so that you don't miss anyone.
Yes, I mean, there's something like 80,000 tests at the moment out of a population of 59 million. It's understandable why we haven't been given a true picture. How long do you think it'll take? How many more tests need to be done in order to get that picture?
It's going to be difficult to determine the numbers of tests. We just have to keep testing, because even if you did 1 million tests, you will still not be able to say how many people do have the test by the virus. But what it will give us is a trend so that we are able to make projections in terms of how many more people we expect should be affected.
The National Health Laboratory Service says that test kits have been ordered from the US about 3 weeks ago, and if they are to come, I'm not sure when they are going to arrive, that you're hoping to push up the numbers quite substantially by the end of the month. What sort of time frame are we looking at here?
Some of the deliveries have been received, and so as we speak now, we are able to do more than, say, about 400,000 tests. So, in fact, the new order is supposed to enable us to do 400,000 tests. So we already had in the system about 120,000 from the government in addition, and about 80,000 from the private sector. So that gives us a good about 600,000 or so tests for the next few weeks. We're still ordering more, but we are not counting those kits. We're just saying that the capacity is such that we are not going to be limited by the availability of tests. We'll keep ordering.
Okay. Your acting Director General said that we'll only reach the peak in September. If that is the case, do you recommend a lockdown until then? What do we need to do in that time?
Well, it's too early for me to make a public statement on the lockdown. The National Coronavirus Command Council will decide that. We just simply look at possibilities of what can happen. Now, at the moment, no one has got exact a picture of what will happen. So what we do, we work on various scenarios to say, if this happens, that's what's likely to happen. What we're trying to do is to get the measures that will help us to reduce the rate of the infection spreading internally, such that we don't have to be under pressure during the winter times. So because of the flus and increased admissions and increased closeness of people and the temperature changes and all of that might actually increase the infection, especially if you undo the lockdown. So that means now we have to be ready to try and treat more people than we are treating now. That way we want to fight it off so that slowly we can push the peak of the epidemic to much later, and that's really our intention. So when the acting Director General was saying that's what we're trying to do, but of course this is a fight, and we only know you move on if you're making an impact or not.
And the fight, I mean, you know, it's widespread, isn't it? Especially when you've got hospitals like St. Augustine's. We know what's happened there, the amount of coronavirus deaths and infections. Tell us what you believe the investigation should uncover in order for this never to happen again.
Look, that's a very difficult situation. It's completely unacceptable, and we don't know how it happened. The first rule when we're dealing with an infectious outbreak is to make sure that your health workers are protected, because those are the soldiers who must be in the forefront to fight the infection. They are taught, they are trained, they need to be protected accordingly, both in terms of protective gear as well as procedures, so that they don't actually come into contact with the virus. This is known, and this is what professional training is all about. So something went wrong here, which we want to check what actually happened. So obviously, we're going to have to go through the investigation, retrace the steps, and look at who was where at what time, where were the patients, and where was the most likely source of the infection, what were the lapses. I think more important for us is to avoid that happening in other hospitals. We're also worried that there may be people who are doing moonlighting work in the hospital that could be infected in one hospital and then spread the infection to another hospital where there was no infection. So all of these issues are what we're looking at.
And not only in hospitals and jails too, the East London Correctional Centre. I mean, obviously one of the big issues right now is getting the right protective gear for anybody who's in the front line.
Yes, obviously the infection was introduced to the prisons from outside. As to how that happened, we'll have to investigate. But you will recall that from the beginning of this whole lockdown, we actually stopped visits to the prisons, because prisons by nature are the areas where infection spread is very much high if there is such an introduction of infection. So we wanted to prevent that, but obviously now we need to look at the staff as to what has happened there, because it's difficult to know where this infection would have come from. They would have to be given protective gear. They'll have to be given drills of how to ensure they stop infection spread. They need to be, sequestration of the affected cohort of prisoners, so that they can be in quarantine inside the prison. And there has to be a way of separating them out, ensuring, distancing between them. And all of those things have to be now enforced quite strongly.
Minister, good to talk to you. Thank you.
Thank you very much.